New at 11:30, we learned this week when North Carolina will expand who gets access to Medicaid. It starts December 1st, and it is a huge deal. More than 500,000 people who previously didn't qualify will now get health coverage. Joining you now, the man responsible for the whole rollout. It's a big job. Secretary of North Carolina Department of Health and Human Services, Kinsley. Secretary, thanks for coming on. We appreciate it.
Great to be here.
All right, so the feds made this move 10 years ago. I think something like 40 other states have already done this. I know it's a political answer, but explain to me what took so long.
You know, our General Assembly was concerned that the federal government may change their portion that they would kick in, but we knew that wasn't going to happen, and it took a lot of voices from all over the state, especially our local sheriffs, our county commissioners, our boards of chambers of commerce, to really say, look, we've got to do this. We need to close the gap for health insurance in North Carolina. 80% of the people that will benefit from this are from working families. We'll have a disproportionately positive impact in our rural communities. And eventually the dollars just made sense. It's going to draw $8 billion into North Carolina every year. That's at no additional cost to the state taxpayer. And so I am really glad, and thanks to Governor Cooper, we got it done.
Let's show, we've got a graphic, I believe, that will show exactly who will qualify in just some mock-ups, some scenarios right here you see. As you mentioned, in a lot of these cases, these are hardworking people who just didn't qualify in the past, right?
These are individuals who work 2 or 3 jobs. Maybe they're a child care worker, which is so critical for the health and well-being of our families and our young children and the economy, but that business can't afford to give that person health insurance. We want that person to be healthy and well. We want them to have health insurance. Medicaid expansion makes that possible.
What does this mean for you over the course of the next 2 months, rolling this out, getting this done? Because I know, because we talked about this in the past, you sort of had to wait till the trigger was pulled on this before you could do some of your work on it.
Yeah, so we've been ready. Since the bipartisan bill on this was signed in March, we have done all of the work. Our team has implemented every aspect that we could up until this point. Now we'll go live December 1st. The great news is that on December 1, because of the technology we've put in place and the work we've done in advance, we're going to be able to move 300,000 people into expansion on day 1, and they won't have to do anything. We'll send them a letter, we'll let them know what's happening, and that's that. The other 300,000 people that we estimate will be eligible will be able to apply and come forward. And we're working with churches and nonprofit organizations to help get the word out so that folks know what to do when that time comes.
Aside from the actual health coverage itself, studies show Medicaid expansion is actually good for the entire community and even the economy.
Yeah, we see consistently in other states that have done this. Again, 40 other states, as you mentioned, where A, it helps control healthcare costs across the board because it makes sure everybody has coverage. B, or 2, it also helps stabilize rural healthcare in rural communities where people are 3 to 4 times as likely to be uninsured, so rural hospitals, et cetera. And so it's a really smart investment for the overall health and well-being of the state.
I know mental health coverage also included in this, and I've seen studies where the suicide rates have gone down in states where this has also been passed.
Yeah, look, this is not just about spending more money. This is about spending money at the right moment. Everybody gets sick. And when they do, they end up in the emergency department. I'd rather, when they get sick, they're able to prevent that illness from becoming serious. They're able to get the treatment and prevention that they need. As they say, an ounce of prevention is worth a pound of cure. This allows us to move the healthcare services we want to offer upstream, and it builds on our strategies of investing in what really drives health: food, transportation, safety.
Finally, what do people need to know? How do they need to apply? Are they going to be contacted? What do they need to do?
Right now, there's nothing folks need to do. In the coming days, we'll be putting on our website all the eligibility criteria so folks can learn about that. We'll reach out to the 300,000 we already know about. December 1 is when people can come forward to apply for expansion.
All right, sounds good. Secretary, thanks for coming on. We appreciate it.
Great to be here.
Larry